I'm Clara Brown, a member of the leadership team from Western Pennsylvania Home Health Association, and I have with me today Representative Ed Gainey of the 24th District of Allegheny County. Thank you for this opportunity.
Thank you for having me. Thank you.
You're welcome. So Allegheny County is second to Palm Beach, Florida, in terms of having the largest amount of senior residents in any given populated area. Last year, in Governor Tom Corbett's administration, they budgeted roughly $1.4 billion for the Office of Long-Term Living Programs. How is the budget impasse in Harrisburg affecting social and human services?
Up until last week, I thought it had a tremendous impact. Whenever you're talking about our most vulnerable citizens, and that's our senior citizens, we need to do as much as possible to make sure that they're safe, to make sure that the money is there for the mental health, for the home-based businesses and everything else. As we know, Governor Wolf has the appropriations for that he's put out, so thousands of people that didn't have services now will have services again. The problem is, just like anything else, it's a partial budget. We need a full budget. In order to really appropriate the right line item for funding, it needs to be a full budget. But I'm happy that he released the health and human service money so that thousands of Pennsylvanians will be all right now.
So do you think that the funding that's in this current budget is adequate to meet the needs of our seniors?
No, we need a full budget. I think if we had a full budget and the amount of money that he was trying to receive that was cut under Corbett, I think we would have. It would have been historical. I mean, when you look at the education money, the health and human service money, $84 million that went back into the budget. That's big. That's big for our seniors and every other social program that we have out there. Without a full budget, we're not going to get the type of benefit we would have gotten.
So at times, we, the citizens in the community, we feel as though our voices aren't being heard. Mm-hmm. It makes us feel as though our concerns and needs aren't being met. Without getting too deep into politics, what can those in need of services and their advocates do to make sure that their interests are being represented by legislators?
I think a lot of times we focus and we advocate in silos. Different organizations coming up from across the state individually. Even if you're a part of a bigger commission, your commission comes up individually. I like to see a bridge built from the four corners of Pennsylvania to talk about the needs of the elderly, the needs of the mental health. Because a lot of people in Harrisburg speak the language, but their voting record is different than what they speak. And I think we as a population, particularly in Pennsylvania, we advocate based on immediate needs and not long-term solutions. So we come up there around budget season and we say we need X, Y, and Z, which is great. I'm not saying that's not good. It is, it's very good, it's great. But what if we did it all year round? What if we said that this is an issue that we want to have quarterly meetings with the governor from all four corners of the state and begin to talk about what population in terms of mental health is rising? What is the need of the elderly right now that we need to be funding? What if we were doing that quarterly with meetings with the governor and the House of Representatives and the Senate? I think then we would have a better understanding of where the market is at and how we need to fund the market to better be able to serve the constituents. That's the level of engagement I think we need. Just the engagement around budget season, that's fine. There's nothing wrong with that. But it doesn't, we need a different strategy for long-term growth.
So last April, I met you in Harrisburg.
Absolutely.
To represent an organization and association that advocates for home health needs for seniors and disabled people. The call to action on that day was to discuss the funding inadequacies. And in 2012, reimbursement rates for non-medical and medical home health services decreased from $19 to $17 an hour. Last year, reimbursement rates for medical home health services from Medicare, Centers for Medicaid Services, also decreased their reimbursements. What is the balance approach to increasing the wages of workers while also providing support to businesses who struggle with adjusting to minimum wage increases?
Well, I have a bill out there now that talks about healthcare workers getting paid $15 an hour. That's one. I think secondly, again, as you just stated, these conversations only come up around budget season. By that time, it's too late. We need to have these conversations earlier. If it's a situation of how do you improve conditions for workers, how do you improve, pay for workers, how do we better serve elderly population that's growing, some of the mental health issues that we have out here that's growing. It can't just be on a day of advocacy. That's not commitment, that's support. Commitment is saying that we're going to set up meetings 4 times a year, every other month, and really begin to drill down the need to be more prepared to how we're going to deal with the elderly, what we're going to do with the people with mental health, what population is growing. I mean, there's populations in the mental health field that are growing, and we know that because we see the numbers. But the problem is the only time that we see a great outpour is when it's budget season and everybody wants to make sure their money is right. And I understand that. You want to make sure your money is right, but that's the issue. Your interest is how do you make it better so that you're serving the population that is the most vulnerable. So if you're looking at it from that standpoint, you wouldn't have to justify why you need the money if all along there was an agenda saying this is what we're talking about to improve services, stability, and employment, better services, better pay, so that we can make sure that we're getting a greater service. We wouldn't have to wait until the last minute if it was a yearly meeting leading up to the budget that provided us the opportunity to hear from you. Statewide, not by organization, statewide. There has to be constant dialogue. I'm up there long enough now to understand that there's lobbyists up there that lobby for those that have extreme money. And they're not meeting once, they're meeting several times. There's organizations that come up there all the time because they understand that they want their interest to be the interest of the vote, from people like me that can increase the value of service. So at the same level, we need to look at that model and see how it's been done and find out how do organizations such as yours that's coming up there during budget season have yearly dialogue with people in the governor's administration and House leadership and Senate leadership to say, here's what we need going forward. How can we work together to get this?
Okay. So essentially what you're saying is that, legislators like yourself would support business owners by providing the funding. You're not just going to let the business owner fail, because a lot of the dialogue is that we can't afford to increase the wages of workers because they're reducing our funding.
This is politics. And in politics, where the political will is, so is the money. And so the wheel that gets the squeaky wheel gets the oil. It's just the reality and the nature of politics. You want an example? Here's a prime example. We don't have a severance tax on Marcellus Shale, one of the biggest industries in the state of Pennsylvania. That means they're up there constantly talking about why there shouldn't be a severance tax on Marcellus Shale. They're talking to leadership. Even though we know it would be for a just cause, and everybody in Pennsylvania should have an opportunity to pay taxes, particularly if you're making a great deal of money off our resources. But yet, instead of putting a moderate tax on Marcellus Shale, we're talking about a personal income tax. We're talking about a sales tax. But we're not talking about someone that's not paying no tax, but has a big industry in the state of Pennsylvania.
So you're distinguishing the fact between there are lobbyists, there are organizations who lobby Congress people, and they lobby for House of Representatives, and their interests are for corporations, but they're not quite seeing how personal people, individuals, how that can cause detriment to them.
Because that's their interest.
Yes.
You see what I mean? They're not going to advocate on your behalf because there's no interest there. That's not how they make their money.
So who's lobbying on behalf of the people?
Well, every organization hires people to do that. They hire lobbyist companies. Lobbyist companies, and they do it. But again, you don't always have to have lobbyists. What you have to have is organization and coordination. Like I ask people all the time, and even as we have this interview, and when you came up to see me, who you talking to in Philadelphia? Who you talking to in Scranton? Who you talking to in Erie? Who you talking to in those areas that do the same type of work that you do, coordination, to organize a movement, to have a level of conversation at the state that empowers your agenda?
That's a good point.
You see?
Yes.
When organizations come up, it's we need our money, we need our money, we need our money. But half of the time we haven't seen them since last year was budget season.
Yeah.
And only because it impacts my district so profoundly is why it's an interest to me. I have 11 senior citizen buildings in my district alone. I understand the need. I understand exactly what's going on. I understand the mental health. I understand what's going on in my district all day and why we need this money. But there's other people that may not have the same type of geographical district as me, nor the population that I have in my district. So they can't have the same type of concern that I have. But I know that there's more that have my concern than not have my concern, because as you stated earlier, the age of Pennsylvania.
Right.
But agencies have to come together, not just in budget season, but again, all year long. Like the nonprofit organizations that we're dealing with now in this budget impasse, that is ridiculous. But at the same, everybody's running now. But what if we would have had this level of engagement from day one? I don't think we would have a budget impasse like this. What if we went into those areas that we know, some of these Republican areas, that we know that their districts are poor to some public housing complexes in the city, and really begin to talk about why the need for social services and health and human services, the money is necessary? What if we begin to build those level of relationships and have those type of conversations with leaders in the House, the Senate, and the governor? We begin to change the dynamic of the game. But until we get that level of coordination, everybody only runs when their organization is affected by money. And that's a small-term growth for a long-term strategy. You can get the small-term money. The money's being released now. But again, we may have another budget impasse next year, because you have a lot of anti-government elected officials that's there to be obstructionists. They'll tell you they don't believe in government. They ran on the whole notion of give me my government back. So we're asking them to believe in raising taxes in order to pay for critical services that we know are needed, so that we can have the money that's necessary to pay workers. We can have the money necessary to provide better services.
So the funding is there. It's just that people don't want to get the funding from certain places. You mentioned Marcellus Shale. What are some of the other?
I mean, nobody wants to, I didn't go to Harrisburg to raise your taxes.
Right.
Nobody wants to raise taxes. But under the you can't cut, I mean, under Corbett, we cut $1 billion from education.
Right.
$1 billion, and we know the impact of that to the local level.
Yes.
We've seen school districts closing.
I know it firsthand.
So you know exactly where I'm coming. So if you cut $1 billion, in order to begin to get some of that funding back, there has to be some taxes that has to be raised. I mean, there's no other way. And so when you look at what Governor Wolf wanted to do in the beginning and use the Marcellus Shale tax in order to fund education, that made sense. That made sense. But again, it was taken off the table because there was no appetite from several members in the General Assembly who come from areas where Marcellus Shale was doing drilling, that they didn't want that to happen. So then you got to look at a sales tax, a personal income tax. You know, some way you have to raise money. And when you cut to the bare bone, you left us with no other option but to evaluate which taxes we can raise in order to raise that funding.
Okay. Well, How can people get in touch with you, get in touch with your office?
100 Sheridan Square, 3rd floor, Pittsburgh, PA, 15206. Phone number is 412-665-5541.
How about the younger generation? How can we reach you?
Well, I'm always around for the younger generation, too. You can call the office, schedule a meeting, 412-665-5501.
Facebook, Twitter?
Facebook, Twitter, Ed Gainey on Facebook, Twitter, Instagram. If we have your information, we send out emails because we know that's the new generation. We're starting to do more email blasts from this office. We've done a lot from the state office as well, but when it comes to different policies and regulations and legislations, we'll be sending them out from here too. So again, I have a lot of events, and my events are to inform people. I may have an event, but the event is really the carrot to get people to come out in order to provide them the information that makes their life better, or at least allows them to know, so they're the first to know and not the last.
Thank you so much again for your
Appreciate
time.
it. Thank you. Thank you.
For more information about the services that we provide at Western Pennsylvania Home Health Association, please visit us at WPHHA.com. I'm Clara Brown. Thank you for listening to this podcast.
Thank you.
Thank you.